Hey, everybody, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. My guest today was on the show recently, but he had such a tremendous response. You guys said, please bring him back. So I am. The first time he was on, he did a talk about nutrition in the brain, part one. So guess what's up today? Nutrition in the brain, part two, or deux, if you're French. Please welcome back to the show, Dr. Neil Nedley. It's so nice to see you again.
Well, thank you very much, Chef AJ. It's great being with you as well.
Yeah, you blew people away by all you knew about nutrition. I mean, people don't think about the brain and nutrition so much. You know, I'm hosting a GI Health Summit this week, and people are thinking about the gut nutrition, but they don't really think about the brain that much.
Well, and there's quite a connection between the gut and the brain. Actually, some of the same neurotransmitters are made in the gut and the brain. And it's one of the reasons why I'm in the brain, because I used to be a gut doctor, a GI doctor, still do scopes and still do GI.
I did not know that. You should have told me. I could have interviewed you for the GI Health Summit. I had no idea, but that's good to know.
Yeah, well, next time.
Absolutely. Absolutely. Well, what have you got for us today, Dr. Nedley?
Well, today we'll share our screen here and talk about some of the exciting new research regarding nutrition in the brain. And some of this new research has to do with something we can measure in the bloodstream called BDNF. That stands for brain-derived neurotrophic factor. And that's something that is measured, and we're seeing a lot of interest as we see how much it's related to brain health. We could think of it as a brain fertilizer, but it's actually a protein, and it's been shown to help the brain to develop new connections, repair failing brain cells, and protect healthy brain cells. Having enough BDNF around can even protect our brains from neurodegenerative diseases like Alzheimer's and Parkinson's disease. And so, in fact, even medications that are being used for depression are now starting to measure BDNF before and after, because if it raises BDNF, it will make it a much more expensive and acceptable antidepressant. When BDNF levels are high, acquiring new knowledge is easy. Memories are retained, and people actually feel happier. And as mentioned, it's a natural antidepressant. But when BDNF levels fall, the opposite occurs. People have difficulties learning new things, and dementia can much more easily occur, and depression is certainly much more common. 144 pilots were studied. And of course, pilot training involves a lot of intellectual function, but also 3D movements with your hands and being able to coordinate things. And of course, when we're hiring a pilot, it's not just to get us from point A to point B. That's the relatively easy part, although it's still much more difficult than driving an automobile or a bus. But what we're really hiring them for is if something goes wrong with that plane, are they going to be able to land it safely? And are they going to be able to figure out precisely what is going wrong, for instance, on the instruments, and ignore that part and just pay attention to the instruments that are accurate and still land it safely at point B? And so those with low BDNF levels out of these 144 pilots had a harder time maintaining their skills over 3 years. Scores dropped twice as fast when their BDNF levels were low. And their hippocampus, which is an area of the brain in the temporal lobe that has to do with memory and even being able to retrieve long-term memory, the hippocampus itself became smaller when the BDNF level was low, because that brain fertilizer wasn't really there anymore. So of course, the big question is, how can we increase BDNF levels? Physical exercise is one of the ways that we can do this as we become more fit through exercise. Intellectual activity, just by actually, being here live or seeing a recording of this and engaging in the intellectual activity, will actually improve your BDNF levels. And being social, nurturing relationships. We have found that social media doesn't do the same as far as BDNF levels, like real face-to-face social interactions. One of the disadvantages of the COVID era, where there's less face-to-face interaction going on. Being in sunlight also helps BDNF levels, particularly when the sun is being shined through the eyes or we're out in blue sky. That can also improve BDNF levels. And as we learn to manage our stress, that can also improve BDNF levels. So just the exercise of cognitive behavioral therapy and learning how to manage the day-to-day frustrations can actually help us improve our venous BDNF levels. And also getting enough sleep. At least 7 hours of sleep a night has been associated with BDNF levels. But there have been some interesting differences between all of these ways to raise BDNF levels. For instance, BDNF levels do not go down when you're sleep deprived. Say you're only getting 5 hours of sleep or maybe 6 hours of sleep. If, and that only if component, if you are on a regular aerobic exercise program. This is one of the things I have to tell my patients. Some people say they don't have time to exercise. And of course, they prioritize sleep over exercise. But in general, it would be better for you to maybe get on 1 hour less sleep per day and get an hour of aerobic exercise in its place, because BDNF levels will actually stay high, even though we're sleep deprived, if we're on a regular exercise program. And this study was done in postmenopausal females, which is a particularly important group to see. And of course, many postmenopausal females have problems with sleep because their estrogen levels have fallen, but they won't suffer the consequences of that so much if they're on a regular exercise program. But of course, we're speaking of nutrition in the brain. So we know that BDNF is going to have a role to play in nutrition, and indeed it does. Excess calories can reduce synaptic plasticity and increase the vulnerability of cells to damage by causing free radical formation that surpasses the buffering capacity of the cell. And so this is the whole idea of caloric restriction. If we're eating and we're gaining weight and we have excess calories, there's actually a cognitive penalty that our nervous system pays in regards to that. Moderate caloric restriction thus protects the brain by reducing oxidative damage to cellular proteins, lipids, and nucleic acids. Our brain is particularly vulnerable to degeneration over time. This is why we have this important blood-brain barrier that's present to help protect the brain from toxins and neurodegeneration. But it turns out one of the best things we can do is to have restricted calories and not eating to excess. Many of the beneficial effects of caloric restriction and fasting appear to be mediated by the nervous system. And intermittent fasting results in increased production of BDNF levels, which increases the resistance of neurons in the brain to dysfunction and degeneration. And so this can even occur on a daily basis if we are fasting, what's called intermittent fasting, on a daily basis. For instance, resting our guts periodically through daily fasting triggers a cascade of hormonal events in our bodies, which actually boosts our body's repair mechanisms. BDNF has been shown to go up as little as a 12-hour fast and can go up even more with a 17-hour daily fast. Now, we're running a residential program right now, Chef AJ, for depression and anxiety recovery. In fact, at this very time that I'm speaking, my wife is doing a cooking school for the depression and anxiety recovery guests that are here, some of them with severe cases that have had a lot of complications and a lot of trouble, and now have found out about getting to the root underlying cause. But for some of these individuals, it depends, again, on their genetics and the underlying cause. But for more than some, probably half of the ones that are here at this program, we're actually recommending that they eat a good breakfast. We're going to talk about the healthy breakfast and what that can do. And then they eat a healthy lunch. And then they're actually done for the rest of the day. So they are fasting for 17 hours. Lunchtime here is a little later in the day for those doing that. So it's between 1 and 2. So from 2 o'clock in the morning, or I should say 2 o'clock in the afternoon, till 7 o'clock in the morning, that's 17 hours. And their BDNF levels will come up very nice. The positive neuroplasticity switches are turned on, and they are actually able to have their brains change quicker and healthier with the other things that we're doing to enhance their brain performance and actually eradicate depression and anxiety. If you fast for over 12 hours, what happens is metabolism of fat stores release fatty acids called ketones to be produced. And those ketones actually have been shown to improve memory, improve learning, and reduce neurodegeneration. In fact, some people have taken this a little bit to extremes, and they'll actually recommend that people get on a high protein diet, a high fat diet, and no carbs so that they can go into ketosis. And yes, ketosis has healthy elements, but they're missing out on the healthy elements of carbs, because carbs are actually very important to be able to get tryptophan and tyrosine into the brain and for us to be able to make adequate neurotransmitters. Well, it turns out we can have a win-win if we're on a more healthy carb and adequate protein diet with also adequate fat in breakfast and lunch, and have this daily ketosis event of the 17 hours, then we have a win-win. And we're only seeing significant benefits occur in these individuals as a result of this. Prolonged daily fasting goes beyond just the brain, however. Overnight fasting in such a way that we just described, 12 to 17 hours, actually has been shown to reduce the risk of breast cancer recurrence in those who've had breast cancer. So it actually stimulates the immune system. And there is now a lot of studies, if you want to look up the phrase time-restricted feeding, this is what a lot of studies are being done on time-restricted feeding, particularly in its relationship to improving a lot of disease processes. And our gut resting periodically actually is one of the things that really helps the brain instead of always having food in the stomach. Speaking of breakfast, there have been many mental health advantages to eating a balanced breakfast. So this is the meal we don't want to skip. Studies have shown better cognitive performance, better scholastic scores, improved learning, memory, and intelligence, improved creativity. And there's been a link between skipping breakfast and depression in 5,000 students that were studied. And breakfast eaters have a more positive mood overall, perform better on spatial orientation tests, which have to do, again, with IQ, and feel calmer at the end of testing, so they don't have as much of the test anxiety. And so some other aspects that would be important to discuss is a nutrient that tends to be undersupplied in the typical American diet, that is an essential fat. Now, it turns out, as far as dietary fats are concerned, there's only two essential ones that we have to get in our diet. There's omega-6 fatty acids, which tend to be rather plentiful in the plant kingdom. And then there's omega-3 fatty acids, which are anti-inflammatory and have some very positive brain effects. Low omega-3 fatty acid intake has been shown as a nutritional cause of lack of mental power. And omega-3 has been shown to benefit healthy persons by improving their frontal lobe function, improving their sense of well-being, improving their vigor and energy, improving reaction time. Their attention spans actually get better, and their test scores also go up, and overall an improvement in mood and better control of thoughts and behavior and less impulsivity. And of course, that's a win-win, because the antidepressants, some of them can actually improve mood, but they do it at the expense of worsening impulsivity. That's why many of them have black box warnings, because the risk of suicide actually goes up before depression gets better. And if someone's very depressed and thinking of ending their life, actually being placed on an antidepressant could push them over the edge because it's going to worsen their impulsivity. And suicide is often an impulsive event. Where if they're put on omega-3, it can improve their mood and actually improve their impulsivity, meaning that they're actually going to have less of a risk of going off and doing something impulsive such as that. Omega-3 has also been shown to be beneficial in mental disease. It decreases the risk of at-risk young people becoming psychotic. There's actually an interesting study that was done recently on those who are very good at reading facial expressions. And you can actually go through third grade pictures in an elementary school. And if you're very good at doing so, you can identify the kids that are at risk of developing psychosis. And some of this can be due to genetics and other factors. But if we put them on omega-3 at an earlier age, they'll be at far less risk of developing this schizophrenia or psychosis by the time they're 20. It helps prevent major depression and anxiety in women with psychological distress. It's been shown to decrease anger in men with aggressive behaviors and problems with the law. And there's a clinical response rate of over 50% in those with major depression and or anxiety. That's as good as what you'll get in your best medicines. And if omega-3 could actually be patented and sold as an antidepressant, it would be one of the most popular antidepressants out there because the side effect profile is going to be great. And you're going to have a clinical response rate as good as you would with the, a typical good antidepressant. And the other win is, unlike a lot of the antidepressants, bipolar disorders improve. So it not only improves depression, but it actually improves the mania spells. And it actually prevents the hypomania and the mania. This was shown by Case Western Reserve in Cleveland, Ohio. Additional benefits of omega-3, it actually improves memory in those with middle-age related cognitive decline. A lot of people start to fall off on their memory as they age. And studies show that if we can keep that brain teeming with omega-3, it actually does protect neurodegeneration. It improves aggression and depression in those with borderline personality disorder. It's been shown, as mentioned, to lower the risk of dementia, and it can improve some aspects, at least, of attention deficit hyperactivity disorder. And if you are pregnant, it's very important for you to be getting enough of this, because if you get enough omega-3, your baby is going to be smarter. It will actually be able to learn, retain, and apply knowledge far better. And this is one of the advantages of breastfeeding as well after you have the baby, and being on good omega-3 foods, because that breastfed baby intellectual and cognitive development will be better as a result of being on that omega-3. Now, formulas don't have omega-3 in general. There's one formula now that has just one form of omega-3. There's a reason why they don't allow omega-3s to be put in formulas, and that's because most omega-3, as we're going to discuss, comes from fish. And fish is one of the most toxic supplies that you can get today because of mercury and other toxins. And so they only allow a plant source of omega-3 to be available for that one supplement. But if you're breastfeeding, you can get plenty of omega-3 in your child's milk. It's also been shown to be helpful for traumatic brain injury. In fact, we see a lot of patients that have had concussions, and the inflammation that occurs after traumatic brain injury dramatically increases depression, anxiety, and cognitive decline. And one of the best things we can do after traumatic brain injury is put a patient on high omega-3 foods or even omega-3 supplements. And the nice thing about omega-3, as you might have guessed, it's been found to increase BDNF levels. And because it decreases inflammation in the brain, it decreases the amount of neuronal death that will occur post-traumatic brain injury. So how do most people get their omega-3? Of course, fish is the typical American diet source. And Listed here are the top 10 fish in omega-3. And, this used to be a great way of getting your omega-3 a few years ago. Let's say 100 years ago, it was a great way to get your omega-3, but not so much today because of what we call biomagnification. And biomagnification means that if there are toxins in the water, they tend to be concentrated up to 1,000,000-fold in the fat of fish. Let me give you an example. One of those toxins is DDD, which is not good for the brain and could even be carcinogenic. It has gotten into a rural lake up in Northern California called Clear Lake, California. The lake water has 0.02 parts per million. Now, the EPA would tell you, well, that's safe. It's a very low level. We shouldn't be too worried about the water there in Clear Lake. But the phytoplankton living in the DDD contaminated water have a little more, may be concerning. But the herbivorous fish that eat the phytoplankton, 40 to 300 parts per million of DDD. Well, now this is starting to get our attention. And then the carnivorous fish, which is the fish that people actually eat, that are eating the herbivorous fish, 2,500 parts per million of DDD. Well, that's a very unsafe level, and that can increase your risk of cancer, increase your risk of anxiety, and other mood disorders. And of course, the same thing is occurring in regards to mercury. In fact, this is the #1 supply of mercury in America. And the connection between fish and body mercury levels is so strong that researchers seeking to determine mercury exposures among groups of people often look at only one dietary factor, and that is fish consumption. And so mercury is not like certain trace minerals where we need a small amount but not too much. Mercury, we don't want any in the system because mercury is toxic to the brain at any level. What does it do? It increases the risk of insomnia, nervousness, even hallucinations, memory loss, headache is common, dizziness, anxiety, irritability, daytime drowsiness, emotional instability, and of course, it's linked to depression as well as poor cognitive function. And so all of the things that we're trying to do when people come to our depression and anxiety recovery program is to really treat these symptoms. But in reality, if you're getting your fish from typical sources, you're actually getting more risk from the mercury than you are benefits from the omega-3. And that's what's been shown recently. In the 1980s, everyone was saying we need to get more fish because we need more of these omega-3s. And by the way, fish don't make omega-3. They get it from the plants of the water. So they don't have any more ability to make it than we do. But it turns out sea plants and also water plants tend to be much higher in omega-3 than omega-6. And so the fish get it from there. And so we're getting it, second and third hand from those fish, but we're also getting the concentrated toxins. And so now there's been a number of studies, one in which we published on 8,000 of our patients where we were measuring these things. And we found out that fish eaters actually have a significantly higher risk of depression and anxiety. And years ago, before all those toxins came in, it would actually lower the risk, but not anymore. It actually raises the risk. And of course, there's other toxins that can impair mental performance as well that can be present in fish, such as PCBs and dioxins and pesticides, even lead and polychlorinated naphthalenes. So the idea is to still get omega-3. We want it because it is essential, but without mercury, without toxins, and without cholesterol. And that means getting it from plants. And fortunately, land plant sources, some of them are pretty good sources of omega-3. Almonds is one of those, just a quarter cup, 136 milligrams. Spinach is an excellent source, 353 milligrams. Green soybeans, 637. Now, mature soybeans are going to be high in your omega-6, but the green soybeans or edamame is high in omega-3. Soybean oil from the green soybeans is going to be high in it. Wheat germ oil, if you're getting white bread, you're not getting your omega-3. This is why you want the whole wheat bread for multiple reasons. But whole wheat bread is actually good for the brain if you're not sensitive to the gluten, and it turns out 96% of the public is not sensitive to gluten, and wheat can be very healthy for them for several reasons, but one of them is omega-3. Black walnuts are a good source. English walnuts, even a better source. And then chia seeds is up there near the top, just 1 tablespoon, 7,289 milligrams. That's more than you'll get in any fish. And flaxseed is even higher yet, 1 tablespoon, 7,526. And sorry about the variation in the spaces of where those are at. I think that's something related to Zoom, because the previous presentation that I did using that, they were all lined up, but you can still get the information and the ideas from this. I should mention as well that when we're on a plant-based diet, we also can make more of the additional omega-3 molecules that come from these foods. These foods have an omega-3 molecule that's 18 carbons in length called alpha-linolenic acid. But the brain also uses icosapentaenoic acid, which is a 20 carbon omega-3, and docahexaenoic acid, which is a 22 carbon omega-3. Those have been shown to be very important in cognitive performance and brain performance. And we can make that from the omega-3 in these foods, particularly if we are plant-based, because arachidonic acid, which is present in meat and also eggs, arachidonic acid will actually prevent us, that's an omega-6 fatty acid, it'll prevent us from making as much of the EPA and DHA. And so that's one of the additional advantages of that. And of course, the other way we could get the EPA and the DHA directly, which is not really present appreciably in land plants, is the plants of the waters. Seaweed, for instance, can be very high in this. And so plants of the waters in particular can be higher sources. So for some of my patients, for instance, that are not going to go plant-based for whatever reason, and they need omega-3, their blood tests are showing that they're very short in it. We will actually put them on supplements that come from the plants of the waters. This is much better than fish oil, because there's no way we can get all the mercury out of fish oil. In fact, one company that makes an omega-3 from fish called Lovesa that is prescription, they weren't able to patent the omega-3, but they were able to patent the mercury removal process from the fish. A 3-step mercury removal process is the best process we know to remove mercury from fish. It only removes about 95% of the mercury. And it's far better to get it from the plants, which you don't have to do a mercury removal process. It's going to have far less mercury than what the Lovesa is. Lovesa normally costs about $250 a month for that, where you can get supplements like Opti3 or New IQ that come from the land plants that are going to be, 15% of that price, just maybe $30 or something like that. And it's better all the way around. So for some people, we might recommend supplements, particularly if they aren't going to go plant-based. Junk food has been related to lower IQ and brain function in children. This is a study in over 4,000 kids, and it was controlled for all of the known factors that can affect IQ. And we found those that had the most health-conscious diet, more fruits, vegetables, salad, pasta, and rice, had a 5-point higher IQ than those that had the highest processed diet, higher in fat and sugar in particular. Now, if you would take a look at the top 1 percentile, which would be more of your plant-based, it could even have a 15-point IQ advantage. And then, of course, it can go the other way as well, which was kind of an interesting study out of Great Britain. Children that have higher IQs genetically or environmentally. IQ is not just genetic. There's a lot of environmental influences in raising your children that can raise your IQ. When they had high IQs as children, they were more likely to become vegetarians when they grew up. And this was a study of 8,000 men and women. They were looked at age 30, but their IQs had all been measured when they were 10. And it showed that the higher the IQ of the 10-year-old, the greater the odds of becoming a vegetarian by the time they were 30. For each 15-point rise in IQ scores in the study, the likelihood of being a vegetarian rose by 38%. And this was even after adjusting to factors such as social class and education. The link was still consistent. Now, I know for a lot of your viewers, Chef AJ, maybe they're being asked sometimes when they go out to eat or with friends that don't know their dietary practices, as far as maybe why they've decided to go plant-based or why they are a vegetarian. If they don't have much time to answer, they can now, as a result of this study, just say high IQ. But it may not show the most emotional intelligence to say that, but essentially that's what the study is showing. Now, at the time, you can see this was published in the British Medical Journal. They, of course, defined IQ as the ability to learn, retain, and apply knowledge. So this shouldn't be surprising. If you have high IQ, you're more likely to learn the benefits of a better diet. You're more likely to retain that information, and then you're more likely to apply that information later. And essentially, that's what the study was showing. So I want to also, if possible, go into some of the genetic issues that are associated with some mental health challenges. One of the most common that we see in our program, and we get people from all over the world, but also in this country, is a condition called undermethylation. And this tends to come with personality issues. It's a genetic issue where you have a decrease in activity of serotonin and dopamine receptors. And this is often due to the inability to make enough serotonin and dopamine in the brain. 38% of those with a genetic mutation that's associated with depression is going to have this condition. And we can actually measure your methylation ability in the bloodstream. This is a more sophisticated test. It has to be frozen on contact, and it has to be from whole blood. But if that whole blood histamine is greater than 70, the patient is going to be an undermethylator. And if it's up over 140, that's severe undermethylation. And this will come with personalities. It's amazing. People will come to us and I'll look at their blood and not even interview them in regards to their personality or all of these things. And I'll get their blood back and I will tell them what their personality is like. And they'll just be absolutely amazed that I'm able to do this. But people with undermethylation tend to have a strong will. They tend to be more controlling, and they also tend to have more obsessions, in particular, repetitive thoughts that are not necessarily the most rational. They do tend to be higher achievers, however. These are people that, you know, they want to get a 4.0, and they'll be well motivated to do that in school. Or if they're in sports and they want to be the pitcher that stares down that batter and does what they can do to strike out that batter. So a lot of people that excel in academics or excel in sports are also undermethylators. Being socially accepted is not a high priority for them. They are social beings. They can be great family members and things, but the social acceptance rate is not, you know, at the highest priority for them. So they can kind of beat to their own drum at times. They do have a tendency to ruminate, however. So when things happen that aren't exactly the best, they will ruminate over this and have it go over and over in their mind. But probably the characteristic that is most pervasive among undermethylators is they're good at having a calm exterior, but inside they tend to be very tense, a tense interior. And they also can have other associations. Undermethylators are more likely to have that addictive personality where they can get addicted to things. They can have a high libido and run into problems as a result of that. And so we can see other side effects of what we could say in regards to undermethylation. Well, the good news is epigenetics. Epigenetics, we're now finding out that if you have a mutation that's associated with something like this, we can, through diet and lifestyle, actually shut that mutation down and reverse the effects of the undermethylation. This is one of the reasons why we're measuring people's genetics and also epigenetics to see what is going on and whether that gene is active or not, because then we can do an intervention, sometimes a nutritional intervention, and then we can remeasure it and show that that gene is no longer active. In other words, they're getting adequate serotonin and dopamine production, and they're getting adequate serotonin and dopamine activity. This is a slide that actually shows a little bit of what I'm talking about here. If you see in white, you see this at the very right side of this screen, you see methyl donation. That this is what we call methylation. So it is actually methylating these molecules, and it's methylated through a molecule called S-adenosylmethionine. And that produces the final step to produce 3 different neurotransmitters: dopamine, 5-hydroxytryptophan, and norepinephrine. 5-hydroxytryptophan then gets turned into serotonin. And so these are the most important, or some of the most important neurotransmitters in the brain. This is what every pharmaceutical company is trying to manipulate in some way, shape, or form. But they're not able to help you to make more of these molecules, nor are they able to help you build up more receptors to these molecules. What they're doing is blocking the reuptake of the releasing neuron so that there's more of these neurotransmitters in the synapse, and that can produce more activity. But that comes at a cost. If we block the vacuum cleaners from vacuuming it back up into the neuron, we're far less efficient, and we're going to short the neuron of the very substance we were trying to treat. This is why these drugs should only be used short term. After they're used for about a year, they're actually going to cause the very problem they were designed to treat, because they're going to cause even a greater shortage of serotonin and norepinephrine. This is why it's far better to get at the root of the problem. And if we can get at the root of the problem and shut down the gene, for instance, that is producing this issue, what a difference it can make. And so as you get an idea here, if you're not getting enough folate, which is over on the left-hand side, that could produce a methylation problem. If you're not getting enough B12, that can produce a methylation problem. In fact, methylcobalamin, you get an idea, that's about methylation. And of course, that will help us make SAMe, which is a naturally made molecule in your body. You can also get it as a supplement, and that can improve your ability to have far better, healthier neurotransmitter activity. So the treatment for undermethylation, it can be SAMe itself. We can actually measure the before and after difference. I'd like to go back, however. If we utilize SAMe and you have too high of a homocysteine, that can produce maybe more harm than good, because we don't want that homocysteine to go up over 10. So I'll normally use something besides SAMe to get this person to methylate better if their homocysteine is greater than 10. Methionine is an amino acid that is important. It's present in grains, for instance. It's present in wheat, also present in quinoa. And methionine, it's also present actually in green soybeans as well. Edamame is a good source of methionine. And methionine will actually help us to methylate. Calcium and magnesium can also help us to methylate better. And sometimes for the tenseness, we'll use a natural herbal preparation called inositol. But also, undermethylators tend to like the typical antidepressants, the SSRIs, because it is helping them to improve particularly their serotonin activity. But once again, it's going to come at a cost, so it'd be far better to try to correct the underlying cause than just cover it with SSRIs. And then there's another nutrient called serine that can actually help. Now, taking a look at calcium, I recommend, just like the US government, that you get 800 milligrams to 1,000 milligrams of calcium per day in your diet. And as good as oatmeal is, oatmeal can help us with other things. It's high in melatonin. It's not a very good source of calcium. Lentils also not the greatest source, but there are better sources. Quinoa, 1 cup, 102 milligrams. Rutabaga is a cup, 115. Dandelion greens, 1 cup, 147 milligrams. Mustard greens are an excellent source, 152. Baked beans, 154. Sesame seeds, 176. Blackstrap molasses, also an excellent source. Kale, very tasty, tender green, 1 cup, 179 milligrams. And then there's even higher sources. Turnip greens. Hazelnuts is the nut that's highest in calcium. Green soybeans, once again, 1 cup, 261 milligrams. 10 figs, 269 milligrams. 1 cup of whole milk, 290 milligrams. Amaranth grain, 1 cup, 298 milligrams. Non-fat skim milk will have a little more. And collard greens will even have a lot more. Now, I should mention that although milk looks like a great source of calcium there, and it is not a bad source, you will actually absorb more calcium from turnip greens than you will from milk, because turnip greens are high in calcium and low in phosphorus, where cow's milk is high in both calcium and phosphorus, so we don't absorb as much from cow's milk, but we'll absorb a huge amount from collard greens. Carob is actually a great source of calcium as well. It's a legume. And lamb's quarters is the highest source, 1 cup, 464 milligrams. And that's not the hind leg of a small sheep. That's actually a weed. It's a very tender, nice green weed. You can get it sometimes in Whole Foods, or you could get it in your garden if you know what to look for. Very tasty green, very high in calcium, and can help with the methylation along with high magnesium foods. Now, I also want to mention overmethylation, because some people actually don't have a problem with serotonin activity. In fact, if you put them on an SSRI, they're going to get a lot worse, even though they can have depression. This is why I always take a look at the genetics and the epigenetics before I even choose medicines for people, because otherwise it's the trial and error approach. Try this, try that. It can make you even worse. And then you get pretty discouraged trying this or that, where if we understand the epigenetics and what's going on brain chemistry wise, we can be a lot more precise. About 20% of people that have a genetic problem with their depression are overmethylators, and they tend to have particularly high labile anxiety. They also tend to have sleep disorders. And if you put them on an SSRI, they're going to feel worse within days. They can be more hyperactive. They can have a problem losing their temper. But these people, unlike the undermethylators that are competitive, overmethylators are not competitive per se, but they're very skilled. They tend to be more creative. They can be very musical, can be very artistic. And they're more naturally empathetic individuals. You'd like to have an overmethylator as your neighbor, because they're going to check on you and they're going to be concerned about you and they're going to want to develop a relationship with you. They tend to be where undermethylators, social things were not necessarily a super high priority. For an overmethylator, it is. It's important, their social life. And so overmethylators would have a lot more problems with the COVID situation that is circling our nation, because it's keeping them away from real life social interaction. But they tend to be great social people. Everybody tends to like overmethylators, although they can have some issues. And some of the issues they have are sensitivities. A lot of people think they're allergic to this food or sensitive to that food or that chemical. And we find out if we correct their overmethylation, it's not food sensitivities at all. It's actually a genetic mutation setting them up for this condition. So treatment of overmethylation involves actually more folate. Folate in larger amounts is a serotonin reuptake promoter. And so that can help. A form of B12 called hydroxycobalamin, which is a detoxifying B12 is very helpful for overmethylators. And then foods that are high in choline can also be helpful, as well as niacinamide and chromium. Speaking of folate, this is undersupplied in the typical American diet. And you can see, a double serving of steak, only 16 micrograms. The US government says we need 400 micrograms, but for optimal brain health, particularly for an overmethylator, they would need to get over 1,000 micrograms a day. And you can see parsnips, pineapple juice, orange juice, peanuts. These are great sources, but your greens start showing up as well. Think of foliage and folate, and then navy beans, higher yet, okra, higher yet. And the two highest sources are lentils and black-eyed peas. In fact, a cup of black-eyed peas a day can be very helpful for an overmethylator in helping their condition. Choline, we mentioned this. Betaine lowers homocysteine levels, which can be healthy for the brain. And choline improves memory and focus, and it's important for developing and protecting the brain in utero as well. And it's critical to manufacture an important neurotransmitter called acetylcholine that is used in intellectual function. And you can see the high choline and betaine foods would be quinoa, spinach, lamb's quarters. Again, these greens start coming out on top. Soy flour is also a pretty good source, 192 milligrams of choline. Amaranth grain is pretty good. And then there are some more moderate sources such as beets and whole grain and barley, and flaxseed is also not a bad source of choline. And so these would be, we would emphasize this more for those with overmethylation. Another genetic issue is a metal metabolism disorder. And this is where the individual has trouble handling particularly heavy metals such as copper. And copper, once again, it's genetics that loads the gun. It's a mutation where you're not able to make enough ceruloplasmin. And since you can't bind onto the copper, the free copper actually goes high. And when that happens, we're able to not have enough dopamine around because it's being shoved into norepinephrine by the excess copper. And so we have an imbalance in the brain. Too much norepinephrine, which can fuel anxiety, and not enough dopamine, which takes away from our joy and healthy motivation of life. And this can be associated with anxiety, temper problems, anger problems, and particularly hormonal depression problems. People with postpartum depression are very likely to have this. Hormonal events, premenstrual dysphoric disorder, for those whose mood gets low after their ovulation. This can actually just simply be a metal metabolism disorder. Impulsivity goes high. Panic disorder tends to be associated with this. And once again, high norepinephrine, low dopamine. Even headaches such as migraines can be caused by this. And then sensitivity to chemicals, particularly even jewelry, where cheap jewelry can't be worn by these people because they're too sensitive to it, and other metals, again, from their metal metabolism issue. The treatment is to get rid of the excess copper by giving zinc. Zinc actually helps us to get rid of copper, and zinc is not toxic as long as it doesn't lower the copper too low. Sometimes you'll look up zinc and say, well, you know, zinc might be toxic, but it actually isn't, unlike a lot of the other heavy metals, unless it lowers copper too low. So all of the symptoms of zinc toxicity are actually from copper deficiency. And so it's important for us to recognize that. And if someone has this disorder and their free copper is high, we'll gradually build up their zinc consumption. We don't want to lower the copper too quickly because their anxiety level will go up because it's being lowered too quickly. So we bring them down for a safe landing. And then there's other B vitamins that can help them bind onto copper, such as B6 or P5P, and other trace minerals that could have an advantage, such as molybdenum and glutathione. So what foods are highest in zinc? A lot of studies being done in regards to zinc. Zinc, for instance, can even help us with COVID infections, because if zinc gets into the cell, it stops the replication of COVID. It also helps out with mental health. It helps us in a number of different ways. And you can see beans in particular tend to be high in it. Tofu is a good source of zinc as well as calcium. And then you can see the other legumes that are pretty high in it as well, such as lentils and chickpeas, large white beans, and lupin beans, as well as black-eyed peas. But the ones at the top would even be more preferable. There are seeds and nuts that are excellent sources. Brazil nuts are going to have 3 milligrams per 3 ounce serving. Chia seeds, 3 milligrams per 3 ounce serving. Pecans, 3 milligrams as well. But sunflower seeds are going to have even more. Cashews, double the amount that you'll see in pecans. Pine nuts are an excellent source. And fortunately, pumpkin seeds are not very expensive, but they're a great source of zinc. And there's only one seed that beats pumpkin seeds, pine nuts, cashews, and sunflower seeds. And that is a seed that we utilize. And I think Erica might be utilizing right now in her cooking school, hemp seeds, an excellent source of zinc, just 1 3 ounce serving. And then Pyrrole disorder. This is another disorder we'll measure people for. This is associated with poor stress control. They tend to have other issues associated with it, fair complexion for ethnicity. Irrational fears tend to be prominent in Pyrrole disorder. It might not be fear of flying. It might be some other irrational fear. We had someone with Pyrrole disorder had a fear of buttons. And so they couldn't wear any shirt with buttons because of that irrational fear. Negativity tends to be more prominent in those with Pyrrole disorder. And these people don't want breakfast. If left to themselves, they'll be a nighttime person. And if they gain weight, they're going to gain it centrally, even though they'll have a thin neck, wrist, and ankles. And they'll tend to be sensitive to sight, sounds, and textures. They'll get startled easily. These are people that have to cut the tags off of their clothes because of their sensitivity to textures. And mood swings can also occur. In addition, if they're not undermethylators, they tend not to enjoy reading because they don't have a great short-term memory. So they're not able to retain a whole lot of what they read. And they can be more ADHD and have a conduct disorder. And the people along the spectrum are also more likely to have Pyrrole disorder. Fortunately, this is the one that's treated most readily. This is how we'll diagnose it through a specialized research laboratory test. But zinc is also helpful here. Some people might need up to 200 milligrams of zinc to control it, as long as their copper doesn't come down less than 5% free copper. And then there are other nutrients such as selenium that can be helpful in bringing this down, and other antioxidants, and even supplement called NAC. We'll see a response in these people within 1 week and a significant response in 4 weeks. And so once again, this is the exciting world of epigenetics, where we're able to actually shut down genes through nutrition and lifestyle measures and make a significant difference in brain chemistry and even neurotransmission. So I know we're getting close to the end. I'm going to skip through a couple of these slides. Vitamin C, it turns out, is important for us to be able to make enough dopamine. But I also wanted to speak about something called eudaimonia, which I thought you'd be very interested in, Chef AJ. And we'll go through some of this, but eudaimonia is the realization of one's true potential. And it's something we're starting to measure in studies. This is where you're engaged in life. Life has real meaning for you. It has purpose, and you are much more likely to flourish with eudaimonia. You have more curiosity and love of learning, and you're actually more creative as well. Interestingly, a study done in New Zealand in college students, in a large amount of college students, we found out that eudaimonia could be followed in them and can fluctuate on a day-to-day basis related to how many fruits and vegetables the young people ate. What's the least amount they could eat and gain benefit, and where does it level out? Well, I like to talk about where it levels out. The eudaimonia continued to improve up to 7.2 servings of fruits per day and 8.2 servings of vegetables per day. If you add that up, that's over 15 servings a day of fruits and vegetables that was directly related to their eudaimonia on a day-to-day basis. And this goes along with this study of British people, 80,000 dose-response relationship between fruit and vegetable intake and self-reported happiness and life satisfaction. That also has to do with eudaimonia. Most happy people in this study ate over 7 to 8 servings of fruits and vegetables per day. And so, in summary, this is a prestigious psychiatric journal from Europe called Lancet Psychiatry. After reviewing a number of studies, some of which I've reviewed here, they mention this: now is the time for the recognition of the importance of nutrition and nutrient supplementation in psychiatry. Nutritional medicine should now be considered as a mainstream element of psychiatric practice. So if your psychiatrist isn't talking about nutrition, he's not mainstream, he's not caught up yet, and this can often have a much more profound influence potentially than even what medicines you're on. So I'll close with Diderot's proverb so you can ask some questions, Chef AJ, and so we can engage somewhat. But the French philosopher back in the 18th century said this: doctors are always working to preserve our health and cooks to destroy it, but the latter are often the more successful. it doesn't have to be that way if we retrain the cooks to make healthy food that's also tasty. And I know that's what you're all about, Chef AJ. And I want to encourage you that you are improving eudaimonia across your listener and viewer audience as they engage and learn to eat more fruits and vegetables.
I'd give you a standing ovation, but I'm connected to some equipment here. That was unbelievable. Unbelievable. I feel like I should pay you like that, like as if I had gone to a conference.
Well, I hope it's helpful and helpful to you and your viewers.
Unbelievable. You know, when you described all those different conditions, I could almost see myself a little bit in all of them. And I'm thinking, what am I this? I mean, that's just learning so many new things. So fascinating. This is one I'm going to have to listen to at least one more time. You know, when you talked about the BDNF and the pilots, I started thinking maybe when we make our airline reservations, we should ask what the pilot's BDNF is.
Yeah, exactly. Because if it's low, they're not going to be able to retain their skills as well.
That's amazing. Now, you know, you talked about intermittent fasting and hosting this GI Health Summit, you know, or intermittent fasting seems to be good for so many things, weight loss, GI health, but does it absolutely have to be breakfast and lunch? Because socially, for a lot of us, it just works better when we have lunch and dinner. Is that a bad thing to have lunch around 12 and dinner around 5 if we're still having a 16-hour fasting window?
Yeah, that's a good question. And that has been looked at. In general, if you're going to be having dinner on a regular basis. Now, you know, once in a while when you're out for social occasions and things like that, you know, it wouldn't necessarily have to be this 17-hour fast every day. But the studies are showing if we eat a better breakfast and a lighter supper, we'll also benefit to a large degree. So yeah, I mean, it depends on when your sleep wake cycle is and all of that. You know, if you were to eat a later breakfast and have it more of a brunch and then have an earlier dinner, you could get close to having the same effect that we talked about today. And then there's some people we actually don't recommend they do this. Some individuals are they're metabolically not necessarily set up for a 2-meal-a-day program. In other words, they would have a hard time getting enough nutrition. Their stomachs are not enough that they can eat, you know, as healthy a breakfast as we would like them to, with all of those fruits and vegetables. And so these are individuals that need to be on a 3-meal-a-day program, and we would need to forego some of that ketosis for the other benefits that we're going to get otherwise.
Do you think there's natural variations in people's hungers? Because I'm telling you the God honest truth. I'm 60 and a half years old. I've never been hungry in the morning. And people say, well, don't eat the night before. So one time I fasted for 40 hours and I still wasn't hungry the next morning. I stopped eating dinner Sunday night at 6 o'clock. And I woke up Tuesday morning at 8 o'clock and I still wasn't hungry till lunchtime.
Wow. Yeah. Well, that could be. And as we just talked about, Pyrrole disorder.
Uh-oh, that's
So,
me maybe, huh?
we might want to measure your urine cryptopyrroles. That's how we would diagnose that. And that's something, as mentioned, we can fix. So that's something that could, as we fix these issues that could be associated with that, then you can get hungry again in the morning.
Wow. I mean, I feel very healthy otherwise. It's just that, I mean, all this
Yeah.
talk about, and also, you know, I eat savory I don't like sweet breakfasts.
Yes, and of course that can vary from one individual to another as well. But yeah, that's fine. Savory is great.
So we, you know, we have Linda Middlesworth watching, and she's 75 years old, maybe 76. She was voted world's sexiest vegan over 50, and she still teaches aerobics at the gym when it's open. And so I'm guessing she has a lot of this BDNF built up. But if we're somebody that didn't exercise our whole life, can we still later in life catch up and start building it?
We can. Yeah, that's the nice thing. You know, our bodies and brains are susceptible to positive changes even when we are old. And this is why we haven't denied people admittance to our program if we have room for them, even in their 80s. We've had an individual with significant major depression and anxiety. I think the oldest we've had is 88 or 89. But they experience significant benefit, a lot of positive neuroplasticity coming through. So our brains are capable of change even as an older person.
How many people are in your program? How often is it? And is it only in person, or do you do any of these programs online?
Yeah, so we do some programs online. In fact, I would, let me just share my screen again here. So you can, whoops, let me back up. Yeah. So there's a website, Nedley Health Online. We have an Optimize Your Brain program that's now an online program. We didn't used to have depression and anxiety recovery program online, but because of COVID, we have put it there, and a lot of people are benefiting from that. But we also have face-to-face programs. We have an emotional intelligence summit every year. Our next one is February 18, where it's just Thursday through Sunday, but it's all continuing education. We have people from all over the world. If you log on to that website, you'll see all of our speakers. We've got 11 great speakers from all over coming. And then for our residential programs, our face-to-face programs, you would have to be screened by a nurse case manager. But we take 20 in each of our programs. We had one last month. We have one this month. In general, it's every month or every other month. We're not having one in December. So this is our last program of the year, but we will have one coming up in January. And so these are normally 10-day programs, but you can stay longer if you need to. We've had some people stay for as long as a month with significant depression and anxiety. And this is a program that's designed, we measure all of these things. We talked about the epigenetics, a lot of other factors, and we utilize a comprehensive approach to our goal is to eradicate depression and anxiety. And that is done in well over 95% of our cases. It's actually a very exciting program to be a part of, to see the brains change for the better. But that would be for those who need that. You know, they need that that therapeutic doctor-patient relationship, as well as good trained cognitive behavioral therapists and other professionals that work on the purpose and the eudaimonia part of life, and what a difference it can make.
And you're not far from Sacramento, right?
Yeah, we're just 45 minutes outside of Sacramento, the Sacramento airport, and we'll come pick you up right at the airport and bring you to Weimar.
That sounds great. And I bet the food there is amazing. Your wife, in fact, is going to be on the show Monday at 11 a.m. Pacific time doing a cooking demo.
Yeah, I think you'll very much enjoy her. She is a very fun cook, and she has a great time in it.
So Debbie, who's watching live, says, what exercise do you recommend for a person who has no cartilage in knees, waiting for a knee replacement surgery next year? I pointed out that she still has a whole upper body.
She does have a whole upper body, but I would also potentially recommend bicycling, because bicycling actually can improve the muscle length between that knee joint. And so as we build up knee fitness from bicycling, we'll actually have less pain walking because the cartilage is not coming into contact with each other. But as far as nutritional things, there's two little secrets that I might be able to tell you about. Boswellia. Boswellia is an herbal preparation that's also known as Indian frankincense. We've had a lot of success with knee osteoarthritis with that, with just 400 or 500 milligrams twice a day. And then the nutrient I talked about earlier, SAMe, if you look it up, it's also been shown to be very helpful in osteoarthritis and can even help build cartilage in certain cases. And so often I'll use Boswellia first, and then sometimes add in addition to SAMe with the bicycling, and that ought to tide you over enough until you're able to get the replacement if you need one.
Thank you. So here's a question from Charmaine. If mercury is present in carnivorous fish, would it also not be present in the plants eaten by herbivorous fish? Therefore, would it not be present in sea plants that are eaten by people, like seaweed?
Yes, it is actually present in very low amounts. You know, the screen that I showed you 0.02 parts per million. And then in the phytoplankton, it was 5 parts per million. And then in the herbivorous fish, hundreds of parts per million. And so, but the point I was making is that when we get it from the plants, we're getting it in less than 0.1% of what we can get it in fish. And so that's far better than getting fish oil and trying to remove the mercury than getting it from the phytoplankton. But yes, ideally, we'd like to get the phytoplankton from mercury free waters, and that would even be better yet. But yeah, great question.
Great. PJ wants to know if you've written any books.
I have written several books. One of them is called Depression: The Way Out. Another one is called The Lost Art of Thinking. That's the latest book we wrote. We also have a book called Optimize Your Brain. And then we have a book that's much more on internal medicine related conditions, heart disease, cancer, osteoporosis, the inflammatory arthritis. Is called Proof Positive. And that's like a textbook. We actually, that book is utilized as a textbook in several colleges, including Weimar College. And we teach lifestyle treatments of disease out of that textbook.
Nice. Denny says, what do we eat or what do we do to increase serotonin?
Okay, so serotonin comes from tryptophan. And so tryptophan has to be taken up by the brain and cross the blood-brain barrier for us to start making serotonin in the brain. The serotonin in our bloodstream has nothing to do with the serotonin in our brain because the serotonin can't cross over the blood-brain barrier. So we have to get the raw ingredients. And tryptophan has to come with carbs. This is why we don't want turkey. Turkey is high in tryptophan, but it's a carbohydrate deficient food. So we don't get that tryptophan across the blood-brain barrier. So when it comes with carbs like pumpkin seeds or things of that nature, tryptophan is also present in soy. It's also present in tofu, but it is present in a number of things. We have a chapter called Nutrition and the Brain in The Lost Art of Thinking. It's the biggest chapter in there. And it will show you what a difference it can make in regards to the foods that have tryptophan. Once we get that into the brain, then we can start making serotonin in response to light. So it's light through the eyes that helps us to produce more serotonin from the tryptophan that's there. And that can make a significant difference in regards to brain health.
Terrific. And people are wondering if you do consults.
We do consults, yes. We can do them face-to-face. Many people come here to Weimar. We have a consultative clinic here, but we can also do phone consultations as well.
Wow, this has been amazing. You're just so knowledgeable, and it's such an interesting subject.
Well, there's nothing I enjoy more than seeing a brain become completely transformed, one that has apathy, fatigue, concentration issues, mood problems, and then seeing that brain totally transform within a matter of weeks is how can it get any better than that?
That's amazing. Do you have any like people that give testimonials about your program anywhere?
Oh, yes. Yeah, we have plenty of people that have gone through our program, and they'd be very glad to tell you their experience.
Where have you been all my life? I could have used you in my 20s and 30s and 40s. I'm finally doing well now, and I still want to come because it sounds like an amazing place.
Well, you'd be invited anytime, Chef AJ, and we'd have you lead out in our cooking school here.
That would be so great. Well, I look forward to meeting your wife on Monday and having her on the show. And thank you all for watching another episode of Chef AJ Live. Please come back tomorrow when our special guest at 2 p.m. is Dr. Doug Drossman, who founded the Rome Foundation. Have you heard of him, Dr. Nedley?
I have not.
You've heard of the Rome Foundation, though, right? Because it's a GI thing. It's something.
Yeah. Well, yeah, and there's also Rome criteria for certain GI disorders.
Right. He's the founder of that whole thing.
Okay, great.
Yeah, he's a great guy. So thank you, guys, and thanks again, Dr. Nedley. We're welcome here anytime.
Thank you very much, Chef AJ.
Bye.